Hello, I'm Canbo. Today we're going to talk about something incredibly important, something that often operates silently within us until there's a problem: the liver. Specifically, we're discussing liver cancer, a disease that begins when the cells in this vital organ start to grow out of control. It's a topic that can feel daunting, but knowledge is our most powerful tool for understanding and prevention. The liver is a true workhorse, a large, meaty organ that sits on the right side of the belly, protected by the rib cage. It's responsible for so much of our daily well-being. Think of your liver as your body's primary filtration system and metabolic factory. It diligently works around the clock, helping to digest the food you eat, storing essential nutrients like vitamins and sugar for when your body needs energy, and crucially, clearing harmful toxins from your blood. It produces bile to break down fats, makes proteins for blood clotting, and plays a role in your immune system. It's a multi-talented organ that we often take for granted. But what happens when this powerhouse is compromised? When abnormal cells begin to multiply, they can form a tumor, disrupting these critical functions. This disruption is what we call liver cancer. Understanding how this disease develops, who is at risk, and what we can do to protect ourselves is paramount. So let's take a closer look together, breaking down the complexities of liver cancer into clear, manageable information. Our journey into understanding begins now. When we talk about liver cancer, it's not a single, monolithic disease. There are several different types, each originating from different cells within the liver. The most common form, by a significant margin, is hepatocellular carcinoma, or HCC. This type begins in the main liver cells, called hepatocytes. HCC accounts for the vast majority of primary liver cancers diagnosed worldwide. It's often linked to chronic liver diseases, which we'll discuss in more detail shortly. But it's important to remember this name as it's the one you'll encounter most frequently in discussions about primary liver cancer. Next, we have cholangiocarcinoma, also known as bile duct cancer. This cancer forms in the small tube-like bile ducts within the liver that are responsible for carrying bile to the small intestine. While less common than HCC, it presents a unique set of challenges because its symptoms can be subtle until the ducts are significantly blocked. It's a distinct disease that requires a different diagnostic and treatment approach. Then there's angiosarcoma, a very rare and aggressive form of cancer that begins in the blood vessels of the liver. Its rarity makes it difficult to study, and it tends to grow very quickly, often being diagnosed at an advanced stage. Finally, it's crucial to distinguish between primary and secondary liver cancer. What we've discussed so far, HCC, cholangiocarcinoma, angiosarcoma, are primary cancers, meaning they started in the liver. However, it's far more common for cancer to spread to the liver from another part of the body. This is called secondary or metastatic liver cancer. For example, colon, lung, or breast cancer can metastasize to the liver. In these cases, the cancer cells in the liver are colon, lung, or breast cancer cells, and they are treated as such, not as primary liver cancer. Understanding this distinction is fundamental for proper diagnosis and treatment. So what puts someone at risk for developing primary liver cancer? The single most significant risk factor globally is chronic infection with the hepatitis B or hepatitis C viruses. These viruses cause long-term inflammation of the liver, a condition known as chronic hepatitis. Over many years, this constant inflammation can damage the liver cells, leading to cirrhosis or scarring of the liver. This scarred tissue provides a fertile ground for cancerous cells to develop. In fact, cirrhosis, regardless of its cause, is a major precursor to liver cancer. It's a progressive condition where healthy liver tissue is replaced by scar tissue, impairing the liver's function. Beyond viral hepatitis, there are several other causes of cirrhosis that significantly elevate risk. Chronic alcohol abuse is a well-known culprit. Excessive alcohol consumption is directly toxic to liver cells, leading to inflammation and eventually, irreversible scarring. Another increasingly common cause is non-alcoholic fatty liver disease, or NAFLD. This condition, often linked to obesity and type 2 diabetes, involves the buildup of excess fat in the liver. Over time, this can progress to non-alcoholic steatohepatitis, which involves inflammation and liver cell damage, leading to cirrhosis and increasing the risk of cancer. Other risk factors also play a role. Exposure to aflatoxins, which are poisons produced by a specific type of mold that can grow on crops like corn and peanuts, is a major risk factor in certain parts of the world. Lifestyle factors are also critical. Obesity, as mentioned, is a major driver of fatty liver disease. Type 2 diabetes, which is often linked to obesity, also independently increases the risk. And smoking, a habit linked to numerous cancers, also contributes to the risk of developing liver cancer. These factors can act alone or in combination, compounding the danger to your liver health. One of the most challenging aspects of liver cancer is that in its early stages, it often causes no symptoms at all. The liver is a remarkably resilient organ and can function even when partially damaged. This means a tumor can grow for a significant amount of time before a person feels that anything is wrong. This silent nature underscores the importance of screening for individuals who have known risk factors, like cirrhosis or chronic hepatitis. Without screening, the cancer is often discovered at a later, more advanced stage when treatment options may be more limited. As the tumor grows larger, however, it begins to press on surrounding structures and interfere more significantly with the liver's function. This is when symptoms typically start to appear. One of the most common signs is pain or discomfort in the upper abdomen on the right side, just below the rib cage. This might be accompanied by a feeling of fullness or a noticeable lump or mass in that area. The abdomen might also swell due to a buildup of fluid, a condition called ascites, which occurs when the damaged liver can no longer produce enough of certain proteins to keep fluid in the blood vessels. Other symptoms reflect the body's overall systemic response to the cancer and the liver's declining function. Unexplained weight loss and a persistent loss of appetite are very common. Nausea and vomiting can also occur, making it difficult to maintain proper nutrition. One of the most telling signs is jaundice, which is a yellowing of the skin and the whites of the eyes. This happens when the liver can no longer effectively process bilirubin, a yellow pigment formed from the breakdown of red blood cells. General overwhelming fatigue and weakness are also hallmark symptoms as the body struggles with the disease. When liver cancer is suspected, either because of symptoms or during screening of a high-risk patient, doctors use a multi-step process to reach a definitive diagnosis. The journey, often starts with blood tests. One specific blood test checks for a protein called alpha-fetoprotein, or AFP. AFP levels are often elevated in people with hepatocellular carcinoma, which makes it a useful tumor marker. But honestly, it's not a perfect test. Some people with liver cancer have normal AFP levels, and other liver conditions can also cause high levels. So it's really just one piece of the puzzle, not a standalone diagnostic tool. Other blood tests will also be run to check overall liver function. The next crucial step is imaging. These tests create pictures of the liver, letting doctors see the size, shape, and location of any suspicious masses. An ultrasound is often the first imaging test used because it's non-invasive and widely available. If an ultrasound shows a potential tumor, more detailed imaging is usually needed. A CT scan, which stands for computed tomography, or an MRI, magnetic resonance imaging, can provide much more detailed cross-sectional images of the liver. These scans often involve injecting a contrast dye into a vein, which helps highlight the liver's blood vessels and can reveal characteristic patterns that are highly suggestive of liver cancer. In many cases, especially if the imaging results are classic for hepatocellular carcinoma in someone with cirrhosis, a diagnosis can be made without a biopsy. However, if the diagnosis is uncertain, or if a different type of liver cancer is suspected, a liver biopsy is the gold standard. During a biopsy, a doctor uses a thin needle to extract a small sample of tissue from the tumor. This tissue is then examined under a microscope by a pathologist, who can confirm the presence of cancer cells and determine the specific type of cancer. This information is absolutely vital for planning the most effective course of treatment. Once liver cancer is diagnosed and staged, which means figuring out its size and whether it has spread, a multidisciplinary team of doctors will recommend a treatment plan. The choice of treatment is highly individualized, depending on the stage of the cancer, the health of the remaining liver tissue, and the patient's overall health. For early-stage tumors that are confined to the liver, surgery offers the best chance for a cure. This might involve a partial hepatectomy, where the part of the liver containing the tumor is removed, or sometimes a full liver transplant, where the entire diseased liver is replaced with a healthy donor liver. When surgery isn't an option, either because the cancer is too widespread or the patient's liver function is too poor, doctors have other localized treatments to destroy tumors directly. Ablation techniques use extreme heat, like radiofrequency ablation, or cold, called cryoablation, delivered through a needle-like probe to kill cancer cells. Embolization procedures work by cutting off the tumor's blood supply. In transarterial chemoembolization, or TACE, chemotherapy drugs are injected directly into the artery feeding the tumor, followed by particles that block the blood flow, trapping the potent drugs inside the tumor. For more advanced cancers that have spread or can't be treated with local therapies, systemic treatments that travel through the bloodstream are used. Targeted therapy drugs are designed to block specific pathways that cancer cells use to grow and divide. Immunotherapy is a revolutionary approach that unleashes the patient's own immune system to recognize and attack the cancer cells. Traditional chemotherapy, which kills all rapidly dividing cells, is used less often as a first-line treatment for HCC, but may be an option in certain situations. And finally, radiation therapy, using high-energy beams to kill cancer cells, can be used to shrink tumors and relieve symptoms like pain. While we've talked about powerful treatments, the most effective strategy against any disease is, and always will be, prevention. When it comes to liver cancer, there are concrete, actionable steps you can take to dramatically lower your risk. The single most important preventive measure worldwide is vaccination against the hepatitis B virus. The HBV vaccine is safe and highly effective, and honestly, it's a true anti-cancer vaccine. Universal vaccination of infants has led to a dramatic decrease in liver cancer rates in many countries. If you weren't vaccinated as a child, it's a good idea to talk to your doctor about getting the vaccine. For those already living with chronic hepatitis B or C, early and effective treatment is key. Antiviral medications can control the virus, reduce liver inflammation, and significantly lower the risk of progressing to cirrhosis and liver cancer. If you have risk factors for hepatitis like past IV drug use or unprotected sex, getting tested is the first critical step. Another cornerstone of prevention is managing alcohol consumption. Limiting or avoiding alcohol abuse gives your liver a fighting chance to repair itself and prevents the development of alcoholic cirrhosis, which is a major pathway to cancer. Finally, lifestyle modifications are incredibly powerful. Maintaining a healthy weight through a balanced diet and regular exercise is crucial for preventing non-alcoholic fatty liver disease, which is rapidly becoming a leading cause of liver cancer. If you have obesity or type 2 diabetes, working with your doctor to manage these conditions is essential for your liver health. And in regions where aflatoxin exposure is a concern, avoiding improperly stored grains and nuts is important. By taking these preventive measures seriously, you're actively protecting one of your body's most vital organs. We've covered a lot of ground today, from the different types of liver cancer to its causes, symptoms, and treatments. It can feel like a complex and even intimidating subject, but my main goal here today, the one thing I really want you to take away, is that this is not a story about inevitability. It's a story about empowerment. Understanding the risks, chronic hepatitis, alcohol use, obesity, gives you the power to make informed decisions about your health. It really puts you back in the driver's seat. Knowledge is the first and most critical step in the journey of health. The science of medicine is continually advancing, offering new hope and more effective treatments. From targeted therapies that are more precise than ever before, to immunotherapies that harness the incredible power of our own bodies, we are in a much better place than we were a decade ago. But the most powerful medicine we have doesn't come in a pill or an infusion. It comes from prevention. It's the hepatitis B vaccine, it's a healthy diet, it's regular exercise, it's moderating alcohol. These are the choices that build a foundation of wellness and resilience. So I encourage you to be proactive. Talk to your doctor about your personal risk factors. Get screened if you need to. And embrace the preventive strategies we've talked about. Your liver works tirelessly for you every single day. Taking these steps to protect it is one of the greatest investments you can make in your long-term health and well-being. Thank you for joining me on this journey of understanding. Be well.